What's up, everybody? Piscean here, and I'm bringing you my Advanced Medical Astrology Study Guide. Before we get started, I'd appreciate if you like, subscribe, comment, share if you dare and care. I appreciate you with peace and love. I call it the sidereal physician, alright? From melothesia to decumbiture, a comprehensive manual for the astrological diagnoses, prognosis, and energetic healing of disease. So, first let's go over a preface. The human body is a living mandala of celestial intelligences. Since the first physician priests of Mesopotamia correlated lunar phases with epileptic seizures, and Hippocrates declared, "A physician without knowledge of astrology has no right to call himself a physician," the art of healing has been inseparable from the study of the stars. This video, The Sidereal Physician, represents the culmination of the Faculty of Astrology Sciences' work to integrate the ancient traditions of medical astrology. Hellenic or Hellenistic? My bad. Typo. Arabic and Vedic, with the recovered exophysical principles of the heliopause tension index, HTI, sidereal resonance mapping, SRM, and geodetic grid dynamics. If you're confused, please check out my other volumes where I go over these things. So within these pages of this video, you will learn not merely to associate Aries with the head and Saturn with the bones, but to perceive the human organism as a coherent conscious waveform, CCW. Coherent consciousness waveform, resonating within the morphic field of the solar system. Illness is a disturbance in this resonance. Healing is its restoration. The sidereal physician wields the natal chart as a diagnostic tool, the decumbiture chart as a crisis map, and the transits as a clock of pathogenesis and recovery. Rigor is indeed demanded. Contents are both philosophically profound and clinically precise. May this guide serve you as you serve the ailing, and may the stars illuminate your path to mastery. So, let's go over our table of contents here. So part 1 is our foundations of medical astrology. We go over the cosmic anatomy, melothesia and the zodiacal body, planetary physiology, the organs, humors, and metabolic functions, the medical houses being the 1st, 6th, 8th, and the 12th, as well as the natal health imprint, assessing constitutional strengths and weaknesses. Part 2 is our diagnostic techniques, the decumbiture chart, casting the moment of illness, critical days and the lunar cycle, tracking the disease course, planetary signatures of disease, diabetes, cancer, autoimmunity, and mental illness, the HTI in medical astrology, signal fidelity of symptoms and remedies. Part 3 is therapeutic astrology, electional astrology for medical procedures, scheduling surgery and treatment, planetary remedies, gems, herbs, metals, and colors, dietary astrology, eating by the moon and the ascendant, sidereal cartography for healing, relocating to health vertices. Part 4 is advanced medical sidereal studies. We're going to go over the karmic anatomy, Saturn, Pluto, and the chronic disease matrix, the diabetes-cancer axis, Jupiter, Venus, and the metabolic malignancy connection, astrology of epidemics, mundane medical forecasting with eclipses and conjunctions, and the mimetic hazard shield for the sidereal physician. In our appendices, we're going to go over a glossary of medical astrology terms, our melothesia table, full zodiacal and planetary body mapping, planetary herbal and gem correspondences, critical days calculation table, sample decumbiture chart with analysis, dimensional vertices for healing, atlas extract, core formulas, HDI weighted diagnoses, resonant pathology index, and faculty certification in medical sidereal studies. Very excited to bring this to you guys. Let's get started with part 1, our foundations of medical astrology. So, the cosmic anatomy, melothesia in the zodiacal body. Melothesia, from Greek melos, limb, and thesis, placing, is the astrological mapping of the human body onto the celestial sphere. In the sidereal system, the physical form is a miniature of the macrocosm, each part vibrating to a specific zodiacal and planetary frequency. This is not symbolism, it is resonant anatomy. When a planet transits a sign, the corresponding somatic territory is directly activated. When a malefic afflicts a natal planet, the organ associated with that planet's sign placement becomes vulnerable. The student must memorize the complete Melothesia, beginning with Aries at the cranium and descending through Pisces to the feet. Note that in the sidereal zodiac, the signs are fixed relative to the constellations, not the tropical equinox. Thus, the mapping is to the actual stellar energies rather than the seasonal. Sidereal Melothesia, the zodiacal man. It's our first table here. We're going to go over our signs, the body region, organs and systems, and vulnerable conditions. So for Aries, it's Mars, it's the head and the face. Brain, eyes, upper jaw, cerebral circulation. Migraines, head injuries, neuralgia, eye inflammations. Taurus is Venus, it's the neck and the throat. Thyroid gland, vocal cords, cervical spine and ears. Goiter, tonsillitis, stiff neck, metabolic slowdown. Alright. Gemini is Mercury. Shoulders, arms, hands, lungs, bronchial tubes, nervous system, voluntary. Asthma, carpal tunnel, anxiety disorders, scattered focus. Cancer, moon, chest, breast, stomach lining, diaphragm, uterus, lymphatic duct, gastritis, breast cysts, fluid retention, emotional indigestion. Leo is the sun, it's your upper back, spine, and heart. Cardiac muscle, thoracic vertebrae, and spleen, as well as heart palpitations, myocardial weakness, and spinal fevers. Virgo is Mercury. It's your abdomen, intestines, small intestine, pancreas, digestive enzymes, autonomic nerves, IBS, malabsorption, hypochondria, and chronic worry. Libra is Venus. It's your lower back, kidneys, renal system, lumbar spine, skin as balance organ, lower back pain, kidney stones, eczema, pH, and balance. Scorpio is Mars and Pluto. It's the genitals and pelvis, reproductive organs, bladder, colon, prostate, STDs, cystitis, menstrual cramps, chronic constipation. Sagittarius is Jupiter. It's your hips, thighs, liver, glycogen storage, sciatic nerve, femoral artery, sciatica, hip dysplasia, fatty liver, and weight gain. Capricorn is Saturn. The knees, the bones, skeletal system, joints, teeth, hair, osteoarthritis, knee injuries, dental decay, calcification. Aquarius is Saturn and Uranus, calves, ankles, circulatory system, arteries, bioelectrical neural pulses, varicose veins, arrhythmias, ankle sprains, and nerve spasms. Pisces is Jupiter and Neptune, feet, lymphatic system, lymphatic vessels, pineal gland, immune memory, plantar fasciitis, lymphedema, autoimmune confusion, and chronic fatigue. So, we have our planetary distribution across the body. Beyond the sign to part mapping, each planet rules specific tissues and organs irrespective of sign. These are detailed in Module 1-2. The sidereal physician synthesizes both. A Mars transit through Taurus will particularly stress the throat, Taurus, and may manifest as inflammation, Mars, of the thyroid or tonsils. Clinical application here is when a client presents with a complaint, cast their natal chart and current transits. Identify the anatomical sign involved by symptom location. Note any afflicting transits to that sign's ruler or to planets posited in that sign. For example, chronic neck pain, Taurus, may correspond to a transit of Saturn squaring a natal Venus in Taurus, or Saturn itself transiting Taurus. The diagnosis thus links symptom to celestial cause, opening the door to correctly timed intervention. Alright, Module 1-2 is planetary physiology, the organs, humors, and metabolic functions. The planets are not merely abstract archetypes, they are functional intelligences governing specific physiological processes. Each planet rules a humor, a quality, hot, cold, dry, moist, and a suite of organs and metabolic pathways. We have table 1-2 here that shows our planetary rulerships in the body, where we look at the planet, its humor, its quality, key organs and tissues, metabolic, physiological function. So the sun is yellow bile, alright? It's hot, dry. It's the heart, spine, right eye in males, vital spirit, core vitality, ojas in Ayurveda, circadian rhythm and cardiac output. The moon is phlegm. It's cold and moist. The stomach, womb, breast, left thigh in females, all fluids. Fluid homeostasis, mucosal secretions, emotional nutrient absorption, sleep-wake cycle. Mercury is mixed, nervous. It's dry. It's the brain, nerves, lungs, hands, and tongue. In its neural signal transmission, respiratory gas exchange, cognitive processing, and manual dexterity. Venus is phlegm sanguine. It's cool and moist, It's the kidneys, skin, venous system, throat, ovaries. Glucose metabolism, insulin sensitivity, estrogen regulation, venous return, acid-base balance. Mars is yellow bile. It's hot, dry, muscles, blood, arterial, male gonads, bone marrow, inflammation, immune response, fever, testosterone production, acute pain signaling. Going down, we see Jupiter, Saturn. So Jupiter is sanguine. It's hot, moist. It's the liver, pancreas, endocrine, arteries, adipose tissue, nutrient absorption and storage, insulin secretion, growth hormone modulation, and fatty acid oxidation. Saturn is black bile. It's cold and dry. It's the bones, teeth, spleen, skin, epidermis, connective tissue, as well as calcification, chronic degeneration, structural integrity, and lifespan determination. Uranus, Neptune, and Pluto. So Uranus is electrical. It's erratic. It's the nervous system, higher centers, bioelectric field in the ankles, as well as neuronal depolarization, sudden reflex arcs, innovative neural patterns, and disruption of routine rhythms. Neptune is dissolving. It's moist and cold. The pineal gland, lymphatic system, immune cells, T cells, psychosomatic linkage, immune surveillance confusion, spiritual emotional imprinting, and drug sensitivity. Pluto is regenerative. It is hot, moist, and cold, dry alternation. Reproductive organs, stem cells, DNA repair mechanisms, as well as cellular apoptosis, tissue regeneration, genetic expression modulation, and deep-seated infection. So here is the humoral theory in practice. The natal chart reveals the native's constitutional humoral balance, a predominance of planets in fiery signs like Aries, Leo, and Sag, or with a strong Mars-Sun, indicates a choleric temperament, prone to inflammatory conditions, fever, and burnout. A preponderance of Earth and Saturnine energy produces a melancholic constitution with tendencies toward cold, dryness, and chronic degenerative illnesses. The physician prescribes lifestyle, diet, and remedies to balance the humors, cooling a choleric, warming a melancholic, drying a phlegmatic, and moistening a sanguine excess. For example, a client with an Aries Sun, Leo Moon, and Mars rising, all fire, is constitutionally hot and dry. They are likely to suffer from hypertension, migraines, and inflammatory skin conditions. Their therapeutic regimen must emphasize cooling foods, cucumbers, melons, moon-ruled activities, swimming, meditation, and avoidance of excessive heat, spicy foods, and competitive stress during Mars transits. We're going to talk about the medical houses, the 1st, 6th, 8th, and 12th. So while every house has somatic correlations, 4 govern the axis of health and disease, in my opinion. The first house, which is your ascendant or your rising sign, is the physical body itself, okay? So its sign describes the constitutional type and inherent vitality. Planets in the first house directly influence the health of the body part ruled by that sign and planet. The ascendant ruler is the primary health significator. I have vocal cord issues and I'm a Taurus rising conjunct Algol because I was on testosterone. It makes perfect sense. It's in my natal chart. Like, it was bound to happen somehow. The 6th house is acute illness, disease, injury, hygiene, and the day-to-day management of health. The 6th house ruler and planets within reveal the nature of acute episodes and the areas of chronic weakness. Transits through the 6th activate symptomatic outbreaks. The 8th house, surgery, chronic illness, life-threatening crises, and the transformative power of deep healing. It also rules the regenerative capacity and the manner of death. An active 8th house by transit often necessitates surgical intervention or profound psychological, physical catharsis. And the 12th house of hidden illness, undiagnosed conditions, hospitalization, isolation, karmic disease, and the psychosomatic interface. It is the house of the immune system's subtle blind spots and of disease that require spiritual or unconscious integration. Synthesis. A well-aspected angular ascendant ruler promises robust health, while a challenging 6th house indicates the type of recurring acute ailments. A prominent 8th house may indicate a life marked by surgical events or a powerful regenerative crisis. A loaded 12th house demands exploration of the subconscious and possible past life trauma to resolve chronic, elusive symptoms. Right. Assessing constitutional strengths and weaknesses. The sidereal physician creates a health profile from the natal chart, which serves as the foundation for all predictive and therapeutic work. We have our step-by-step protocol, and I'm pretty sure there's only 5 steps here, so pretty easy to follow along. The first step is the ascendant and its ruler. Determine the sign on the ascendant and locate its ruler. We need the accurate time of birth for this. If they don't know and they're guessing, too bad, it's not their chart. Evaluate its dignity, house position, and aspects. A strong ruler, domicile, or exaltation, angular, unafflicted by malefics, indicates a strong vital force. Second, the sun and moon. Of course, the sun is the vital battery. The moon is the fluid regulator and emotional body. So note their signs, houses, and closest aspects. A Sun-Saturn square indicates a lifelong need to manage energy expenditure carefully. A Moon-Pluto conjunction suggests profound emotional intensity that can somatize. The 6th house. Note any planets in the 6th, the sign on its cusp, and the condition of its ruler. This describes the type of illness to which the native is most susceptible. Malefic aspects to personal planets lists all hard aspects like conjunctions, squares, oppositions from Mars and Saturn to the Sun, Moon, Ascendant ruler, and 6th house ruler. These are the primary sites of structural weakness. Lot of fortune. Calculate the ascendant, adding the moon, subtracting the sun for diurnal births, and for nocturnal, the opposite. Its house and aspects reveal the body's capacity for material well-being, including physical resilience. Documentation. The completed health profile summarizes constitutional type, for example, choleric sanguine with a robust, ascendant, but vulnerable nervous system, Mercury affliction. Top 3 strengths, for example, rapid recovery, strong Mars and domicile, emotional resilience, Moon trine Jupiter, good bone structure, Saturn and Capricorn. And top 3 vulnerabilities, this is a different color. For example, prone to migraines, Mercury square Mars and Aries, digestive sensitivity under stress, 6th house Virgo with Neptune opposition, risk of burnout due to overwork, Sun squaring Saturn. Alright, let's get into part 2, starting with the decumbiture chart, casting the moment of illness. These are our diagnostic techniques. So a decumbiture chart is a horary chart erected for the exact moment a patient takes to bed due to illness or the moment they first consult the physician with a specific complaint. Provides a snapshot of the disease process, its cause, its likely course, and its outcome. So, our procedure is as follows. We obtain the exact time. The client must provide the date, time, and location when they first felt incapacitated, decided to seek help, or went to bed due to the complaint. If only the day is known, cast for sunrise, but with reduced reliability, alright? Then erect the chart. Calculate planetary positions and house cusps for that time and place. Next, we need to judge the chart. So the 6th person is the first house, its ruler, and any planets they're in. The moon is also a co-significator of the patient, and the disease itself is the 6th house and its ruler. So malefics in the 6th or the 6th ruler afflicted indicate serious illness. The sign on the 6th describes the nature of the complaint. For example, Gemini is respiratory or nervous, and Capricorn is skeletal or chronic. The physician treatment. The 7th house is the consultant, and the 10th house is the medicine or therapy. A strong benefic here suggests effective treatment. So, the crisis and outcome here, the 8th house of death, surgery, crisis, and the 4th house of the end of the matter. The moon's applying aspects describe the unfolding of the disease. Its last aspect before leaving the sign often shows the resolution. Key signatures in the decumbiture. What's favorable is Jupiter, Venus, in the 1st or the 7th, they're benefics. Moon applying to a benefic trine or sextile. Moon not VOC, void of course, and in a sign of moderate nature, strong and well aspected first ruler. Where it gets dangerous is where malefics Mars, Saturn are in the 1st or the 8th house, especially retrograde or peregrine, Moon applying to a malefic square or opposition from an angle, and Ketu in the 1st house or the 8th house. The ruler of the 8th house afflicting the ascendant ruler. Integration with natal chart. Overlay the decumbiture on the natal chart. If the decumbiture ascendant is conjoined with the natal 6th house ruler, the disease directly activates a pre-existing weakness. The condition is serious and requires careful management. Critical days in the lunar cycle, tracking the disease course. So, the moon's rapid orbit makes it the primary timer of acute illness. I'm gonna grab some water, actually, my voice is just blah. Alright. So the moon's rapid orbit makes it the primary timer of acute illness. The critical days are dates when the transiting moon forms hard angles, like square, opposition, sometimes conjunction to its position in the decumbiture chart. These are turning points. Crises when the disease either peaks and breaks or intensifies toward a dangerous climax. So our classical septenary cycle, ancient physicians Galen, Hippocrates noted the 7-day rhythm. The 7th, 14th, 21st, and 28th days after onset are significant. We refine this by noting the exact lunar aspects. Note the moon's zodiacal position in the decumbiture chart. Calculate the dates and approximate hours when the transiting moon will form the following aspects to that position. Square, which is 90 degrees, first crisis, often a sudden intensification. In opposition, 180 degrees, second crisis, peak of the disease, potential turning point. Square, third crisis, resolution or transition to chronicity, and a conjunction. Completion of cycle, often a relapse or final resolution. Alright, so then we modify by transiting planets. If a crisis day coincides with the transit of a benefic to the decumbiture ascendant, or the moon, the outcome is positively modified. If it coincides with a malefic transit, the danger increases. The physician can warn the patient and caregivers to be especially vigilant on crisis days. If a medical intervention is planned, scheduling it just after a benefic crisis day, post-peak improvement is ideal. Alright. Planetary signatures of disease. We're going to talk about diabetes, cancer, autoimmunity, and mental illness. Specific disease complexes exhibit recurring astrological patterns. The sidereal physician learns to recognize these in the natal chart and anticipate them in transits and progressions. So type 2 diabetes, metabolic syndrome, afflicted Venus, sugar, insulin, and Jupiter, pancreas, liver expansion, right? Common configurations: Venus square or opposition Jupiter, especially if either is in hard aspect to Saturn or Neptune. Venus in its fall, which is Virgo, or detriment, which is Scorpio, Aries, heavily afflicted. Jupiter in detriment, which is Gemini, Virgo, or fall, Capricorn, under malefic rays. Cancer, general, hard Pluto aspects, conjunction, square, opposition to the Sun, Moon, or ascendant ruler. As Pluto governs uncontrolled cellular regeneration, often combined with a weak or afflicted Saturn, loss of containment, Mars square Pluto can trigger acute inflammatory cascades that promote tumor growth. Autoimmune disorders. So Neptune in hard aspect to Mars, confusion of self, non-self, immune system attacking body, or to the first house ruler. A heavily populated 12th house or the 12th house ruler afflicted often underlies the psychosomatic component. The Moon, body's boundary in hard aspect to Neptune, dissolves the sense of physical integrity. Mental illness, depression, anxiety, psychosis. Saturn afflicting the Moon, melancholic depression, emotional numbness, or Mercury, ruminative anxiety, rigid thinking. Neptune squaring the Sun or the Moon is identity confusion and psychosis. Uranus squaring Mercury is erratic thoughts, nervous breakdowns, and the 12th house and Pisces are heavily implicated to mental illness. The role of fixed stars. Certain fixed stars are associated with specific pathologies. For example, and I have this placement, I'll go conjunct my ascendant 26 degrees Taurus, You do not want alcohol in your chart, like on your sun, moon, or your ascendant, to be honest with you. It has been linked to violence and head trauma. Pleiades, or 0 degrees Gemini, to eye complaints. Zosma, 11 degrees Virgo, to victimization and chronic suffering. Faces, 8 degrees Capricorn, to penetrating injuries. In a natal malefic or the ascendant conjunct these stars within 1 degree's orb heightens the specific vulnerability. Alright? On to signal fidelity of symptoms and remedies. The HTI, or the Heliopause Tension Index, in medical astrology, cosmic background noise level, directly impacts medical practice. So, developing during high HTI, being greater than 0.6, the morphic field is turbulent. Symptoms may be vague, misleading, or psychosomatic. Diagnostic tests can yield false positives, negatives. Elective surgeries are at higher risk for complications due to signal scrambling at the cellular level. The physician should prioritize stabilization over intervention and use this period for observation. During low HTI, being lesser than 0.4, the NLCF is clear. Symptoms accurately reflect the underlying pathology, diagnoses are more precise, and treatments have a higher probability of success because the body's healing intelligence can better receive the therapeutic resonance. The Resonant Pathology Index, RPI. This formula helps quantify the astrological severity of a disease at a given time. We see the RPI equals base malefic strength multiplied by affliction factor multiplied by 1, adding HTI, where our base malefic strength equals essential dignity plus angularity of the most afflicting planet on a scale of 0 through 5. Affliction factor equals number of hard aspects from that malefic to health significator, 0.5 per aspect. A high RPI, or greater than 8, during a high HTI signals a potentially dangerous illness that may not present clearly. Urgent, careful assessment is warranted. Right, on to part 3, therapeutic astrology. Let's talk about electional astrology for medical procedures. The moment of a surgical incision, the first dose of a new medication, or the commencement of a therapy protocol is a birth. The chart of that moment influences the outcome. The sidereal physician elects times to maximize beneficence and minimize iatrogenic harm. We have our rules for surgical election. We look at the moon. It should be waxing, which means it's increasing in light. To promote growth and healing, it must not be void of course, or VOC. Avoid the moon in a sign ruling the body part to be operated on. So, for example, no moon in Scorpio for gynecological surgery. Avoid moon in Scorpio generally, infection risk, or in hard aspect to Mars. The ascendant should be a sign not afflicting the surgical site, preferably cardinal or mutable for rapid procedure. Its ruler should be strong and well aspected. Malefics, Saturn and Mars, should not be angular, especially 1st, 4th, 7th, 10th, nor aspecting the ascendant or moon by hard aspect. Retrograde malefics are particularly dangerous. Benefics, Jupiter or Venus ideally rising or culminating or forming a trine sextile to the ascendant or moon. HTI must be below 0.4. If no low HTI window is available, reschedule if possible. Election for starting a new medication. Similar rules apply with emphasis on the moon, applying to a benefic aspect, and the ascendant ruler not afflicted. Planetary remedies, gems, herbs, metals, and colors Each planet has sympathetic resonances with specific substances. Wearing a gem or consuming an herb tuned to a benefic planet that is weak but essentially well placed can strengthen its positive function. For malefics, remedies are generally apotropaic, protective, rather than strengthening. Here we have our table of planetary correspondences for remedies. We have our planet, our gem, our herb, examples, metal, color, tissue salt. For the sun, it's ruby, sandstone. For the gem, its herb is calamus, St. John's wort, rosemary. Metal, gold, orange. For color, and calc-phos, tissue salt. So you guys can take a look and see that the moon coincides with pearl, moonstone, cucumber, melon, white poppy, silver, the color white, calc, flower. Mercury is coinciding with emerald, green tourmaline, lavender, fennel, ginkgo, quicksilver, green, kelly, myrrh. Venus is diamond, rose quartz, rose, thyme, red clover, copper, pink, light blue, nat, phos. Mars is red coral, carnelian, nettle, garlic, cayenne, iron, red, ferrum, phos. Alright? Jupiter is yellow sapphire, citrine, sage, dandelion, hyssop, tin, yellow, purple, nat, sulf. Saturn is blue sapphire, amethyst, comfrey, mullein, horsetail, lead, dark blue, black, calc, sulf. So we have our prescribing principles. Strengthening a weak benefic. If a client has a poorly placed Jupiter, detriment, fall, but it rules the ascendant or the 6th house, recommend a yellow sapphire if affordable, or citrine, and a regular use of Jupiterian herbs, sage tea. These should be initiated on a Thursday, Jupiter's day, during a Jupiterian hour, with the moon waxing, and in a Jupiter-ruled sign being Sagittarius or Pisces. Mitigating a malefic. For a strong afflicting Saturn, do not strengthen it with a blue sapphire unless the client is under strict guidance. Instead, use Saturn's sympathetic resonance in a protective way. Can carry a small piece of lead encased, wear dark blue sparingly, or use mullein leaf as a soothing expectorant during Saturn-ruled respiratory complaints. Dietary astrology. Eating by the moon and the ascendant. Diet is a daily remedy. The natal ascendant's element determines the optimal constitutional diet. The moon sign each day suggests adjustments to harmonize with the current lunar tide. Constitutional diet by ascendant element. So for fire ascendants, Aries, Leo, Sag, rising, benefit from cooling, moistening foods, fresh fruits, vegetables, fish and grains. Avoid excessive red meat, alcohol, and spices, which aggravate heat. Earth ascendants, Taurus, Virgo, Capricorn, require lighter, more stimulating foods to counteract sluggishness. Leafy greens, lean protein, spicy herbs, ginger, cayenne, in moderation. Air ascendants, Gemini, Libra, Aquarius, need grounding, warming foods, root vegetables, nuts, warm soups, and regular meal times to calm the nervous system. And water ascendants, Cancer, Scorpio, Pisces, thrive on warming, drying foods, steamed vegetables, lean meats, spices, and avoiding excessive cold drinks and raw foods that increase phlegm. We have our lunar day diet adjustments. So moon in Aries, high protein, energizing meals, quick to prepare. Moon in Taurus, comfort foods, savoring, slow eating, avoid overindulgence. Moon in Cancer is nurturing, home-cooked meals, easily digestible, soothing. And Moon in Virgo is light, simple, clean, focus on whole foods, avoid junk. Sidereal cartography for healing, relocating to health vertices. Building on a sidereal cartography manual in my previous video, certain dimensional vertices are especially conducive to healing. A client with chronic illness may benefit from a temporary or permanent relocation to a vertex that amplifies a strong harmonious planet in their chart or mitigates a chronic malefic. So for example, Glastonbury, England, we have our vertex, our location, and its resonance is Venus-Neptune, heart chakra, the healing specialty being emotional trauma, grief, artistic therapy for psychosomatic illness, like Titicaca in Peru, Bolivia, Neptune-Venus, navel, stress disorders, chronic fatigue, hormonal balance. Lourdes, France, Moon-Neptune, purification, miraculous remissions, psychospiritual healing, immune support. Bath, England, Saturn-Neptune, mineral springs, arthritis, musculoskeletal disorders, chronic skin conditions. Sedona, USA, Mars-Pluto, vortex energy, chronic fatigue, energy blockages, transformative detoxification. Alright. Our procedure here is to overlay the client's natal chart on the vertex map. Identify vertices where the client's strong, well-aspected Jupiter or Venus is angular, or where a malefic line is mitigated by a benefic vertex resonance. Plan a healing retreat or relocation during a low HCI window when the transiting moon or benefic activates the target vertex. Now let's get into our advanced medical sidereal studies, starting with the karmic anatomy, Saturn, Pluto, and the chronic disease matrix. Well, chronic diseases are not random. They are the physical crystallization of unresolved karmic patterns tracked by the Saturnian hexagon anchor, or SHA. In the natal chart, Saturn reveals the karmic debt and structural weaknesses that will demand attention over a lifetime. Pluto reveals the transformative potential hidden within the pathology. The disease has a dark initiation. Saturn's karmic signature, Saturn in the 6th house, is a life lesson in discipline, service, and health management. Chronic illness may force a native to develop rigorous self-care routines and humility. Like if you see someone that might struggle with obesity, they might have Saturn in the 6th house. Saturn in the 8th house is karmic debt related to shared resources, power, and mortality. The native may confront life-threatening illness that demands surrender and transformation. Saturn afflicting the moon is a past life pattern of emotional deprivation or cruelty that must be healed through learning self-nurturance. Chronic anxiety or depression is a somatic expression of this unlived grief. Pluto's transformative path, Pluto's house and aspect show where the soul has signed up for a death-rebirth cycle. So Pluto transit to the Sun or the Ascendant often coincides with a health crisis that, if survived, reorients the entire life. The physician must support the psychological process as much as the physical. And working with the Saturnian hexagon anchor maintains a ledger of resonance imbalances. Chronic disease indicates a long-standing debt. Therapeutic interventions are more effective when they include conscious acts of karmic restitution. The client must identify and release the emotional behavioral pattern linked to the afflicted planet. For a Saturn moon square, this may involve forgiveness of the mother and reparenting the self. So without this inner work, physical treatments often provide only temporary relief. The diabetes-cancer axis, Jupiter-Venus, and the metabolic malignancy connection. Faculty's research has identified a distinct astrological pathway linking metabolic syndrome, diabetes, to malignancy, cancer. The bridge is the Jupiter-Venus-Pluto triad. Venus governed glucose metabolism and insulin sensitivity via its rulership over the kidneys, throat, and hormonal balance. When Venus is afflicted, hard aspects from Saturn, Neptune, or Pluto, or in fall detriment, the body's ability to process sugar is impaired. Jupiter governs the pancreas, liver, and adipose tissue. In afflicted Jupiter, especially square or opposition Saturn, or in detriment, leads to metabolic excess, insulin resistance, and fatty liver. Pluto is the trigger. When Pluto, by transit or direction, makes a hard aspect to an already sensitized Venus or Jupiter, it can catalyze the malignant transformation of cells that have been bathed in a hyperglycemic, pro-inflammatory environment. Clinical recognition. A natal chart with Venus square Jupiter, especially if Saturn is also involved, is a red flag for metabolic syndrome. If Pluto is also in hard aspect to the Sun, Moon, or the Ascendant, the cancer risk is elevated. The physician must counsel aggressive lifestyle modification, diet, exercise, stress reduction from early adulthood. Annual solar return charts should be monitored for Pluto transits to the Venus-Jupiter midpoint or the 6th house ruler. Astrology of epidemics, mundane medical forecasting with eclipses and conjunctions. So epidemics and pandemics are not random. They're global expressions of specific planetary configurations. The classical signatures are well documented and were used by physicians from the Black Death to the 1918 Spanish flu. So our primary mundane signatures of epidemics. We have Mars-Saturn conjunctions, especially in the same sign. This is the most reliable indicator. The conjunction in a sign activates a global inflammatory Mars and chronic lethal Saturn crises. The 2020 Mars-Saturn conjunction in Capricorn sidereal coincided with the COVID-19 pandemic. Eclipses in the 6th, 12th house axes of the Aries ingress chart. Sun at 0 degrees, sidereal Aries, is the annual chart of the world. Eclipses falling across its 6th, 12th axis indicate a year of significant health challenges. Pluto transits through the 6th or the 8th house of a nation's chart, indicates deep transformation through health crises. Comets and the great conjunctions. Historically, comets and Saturn-Jupiter conjunctions in Earth signs have been associated with pestilence. Forecasting. The medical astrologer tracks the outer planet transits and the Aries ingress. Excuse me again. So when a Mars-Saturn conjunction is approaching, especially in a sign ruling the lungs, Gemini, or the immune system, Pisces, a public health advisory should be issued to strengthen community immunity, prepare healthcare systems, and time public health interventions for low HTI windows. We won't go over that, but I will go over these appendices with you. First, we have a glossary of medical astrology terms. It's not super long. So, affliction is a planet receiving a hard aspect, whether it's conjunction, square, opposition from a malefic, or being in detriment, fall. Ascendant ruler is the planet ruling the sign on the 1st house cusp, the primary significator of health. So, yeah. Crisis days when the transiting moon squares or opposes its decumbiture position, indicating a turning point in illness. Decumbiture chart is a horary chart cast for the moment a patient takes ill or consults a physician. Highlight is the giver of life in medical astrology, the planet or point indicating vitality and lifespan. Talked about this in my other video. Alopecia is the mapping of zodiac signs and planets to specific body parts. RPI is a weighted score quantifying astrological disease severity. Sanguine is the humor of blood associated with Jupiter, hot and very moist. Yellow bile, choleric, is humor of Mars and the Sun. It's hot and dry, governs acute inflammation. Alright. This is the complete zodiacal map, planetary body mapping, zodiacal and planetary body mapping, my Melothesia table. Alright, so we have our sign, body region, organs, and planetary rulers' influence. So, starting with Aries, we know it's the head, brain, eyes, Mars, acute injuries, fevers. Taurus is the neck, thyroid, vocal cords, Venus, metabolic slowness, beauty of voice, or lack thereof. Gemini, arms, lungs, bronchi, nervous system. Mercury, nervous disorders, breath. Cancer, chest, stomach lining, womb. Moon is fluid retention, nurturing deficiency. Leo is the heart, spine, cardiac muscle, vertebrae. Sun, vitality, cardiac output. Virgo is the abdomen, intestines, pancreas, digestive, Mercury, malabsorption, worry. Libra is the lower back, kidneys, renal system, skin, Venus, pH balance, lower back strain. Scorpio is pelvis, genitals, reproductive organs, colon, Mars, Pluto, infections, transformation. Sagittarius is the hips, thighs, liver, sciatic nerve, Jupiter, fatty liver, weight. Capricorn is knees, bones, skeletal system, teeth, Saturn is calcification, chronic pain. Aquarius is calves, ankles, arteries, nerve impulses, Saturn, Uranus, arrhythmia, spasm. Pisces is feet, lymphatic system, pineal, Jupiter, Neptune, immune, confusion, fatigue. Alright, I'll go over that one. Alright, I think I know where we'll leave off. Alright, we're going to look at Appendix D and E, and then we will finish up. So, Appendix D is our critical days calculation table. And the following table calculates the critical days based on a decumbenter moon at 15 degrees exact Leo. Transiting moon's positions are calculated for an example date, May 15th, 2026, 10 UT. The actual calculations must be adjusted for the specific decumbenter moon degree. So we see the crisis day, the date approx, transiting moon aspect to natal decumbenter moon, 15 degrees Leo, and the interpretation. So let's look at the first square, which occurred May 22nd of 2026, let's say. Moon at 15 degrees Scorpio square. First intensification, your symptoms may worsen, diagnostic clarity may emerge. Opposition, May 29th, 2026, moon at 15 degrees Aquarius, opposition. Peak crises, maximum distance from initial state, potential turning point. Third square, June 6th, 2026, moon at 15 degrees Taurus, square. Resolution phase if patient survives, recovery begins, or condition becomes chronic. Conjunction, June 13th, moon returns to 15 degrees Leo, end of cycle, possible relapse or complete recovery. We assess the lunar mansion. The above are exact aspects. So the influence begins about 12 hours before and lasts 12 hours after. Crisis day severity is mitigated if the transiting moon is also trine Venus, or intensified if conjunct Mars. Simple decumbenter chart with analysis. We're just going to go over this quick case. 45-year-old male, so he has a sudden high fever and severe headache. Took to bed on May 15, 2026 at 10 a.m. in Chicago, Illinois. So we have his decumbenter chart summary here, and then we're going to go over an analysis. So mainly we want to see the ascendant, the sun, the moon, and Saturn. Ascendant is at 15 degrees Cancer, so the ruler is the moon, and it's at 28 degrees Scorpio in the 5th house. Also the 6th house, cusp, my bad. It's at 10 degrees Sagittarius, with the ruler being Jupiter, 3 degrees Gemini in the 12th, detriment. Sun is 24 degrees Taurus in the 11th, while Mars is at 9 degrees Leo in the 2nd, applying to a square to the Sun. Moon's last aspect was a trine to Neptune, next aspect is a sextile to Pluto in the 4th, and Saturn at 19 degrees Aquarius in the 8th house retrograde, squaring the ascendant. So the patient, Cancer ascendant, is sensitive, but the moon in Scorpio suggests a deep, possibly hidden infection. Scorpio rules genitals, colon. Moon's placement in the 5th house, pleasure, recreation, may hint at an STD or infection from recreational activity. The disease, 6th house Sag, ruler Jupiter and Gemini in the 12th, indicates a systemic, possibly misdiagnosed condition. Jupiter in detriment in the 12th, hidden illness. The fever, Mars in Leo, square Sun is prominent. Mars in the 2nd house, throat, values, and Leo, heart, spine. Saturn retrograde in the 8th house, squaring the ascendant, is a dangerous signature, chronic underlying condition. Saturn, threatening life, the 8th house. Retrograde Saturn often indicates a recurrence of a past condition. Moon's next sextile to Pluto, regeneration, offers some hope, but the overall chart is worrying. Our outcome prediction is the disease will reach a crisis at the first square, Moon to decumpature Moon. If the patient survives the opposition, the sextile to Pluto suggests deep but possibly successful treatment, powerful antibiotics or surgery. However, the chronic Saturn influence means a long convalescence and potential for relapse. The physician would overlay the patient's natal chart. If the natal 6th house ruler is contacted, the disease is a direct expression of a lifelong vulnerability. Thank you for watching this video. I hope you learned something. With peace and love, Piscean out.